Across the skies of Nigeria, a new fleet of miniature airplanes has been flying. These small planes, called Zips, are revolutionizing the way medical commodities are being delivered to the hardest-to-reach areas in the country. In the rural community of Pambegwa in Kaduna State, the first Zipline facility was launched in Nigeria. Supported by the Kaduna State government, this facility uses a logistic network of autonomous delivery drones to deliver medical supplies to hard-to-reach communities in the state.
Kaduna State welcomes Zipline and its advanced unmanned aerial vehicles or drones technology for instant, safe and secure delivery of medical supplies and consumables to our healthcare facilities. It is a safe, secure and effective technology that will help to advance our government's agenda to improve access for our people to decent health services.
The plan for Zipline is to serve the unreached, to make sure that every human on earth gets the desired health care that they require. So what we are trying to do in Nigeria, as we are doing in Rwanda, we are doing in Ghana, we are doing in Cote d'Ivoire and even Kenya, is the same thing we're going to do here. We're going to ensure that every hard-to-reach area, every hard-to-reach health facility, every hard-to-reach individuals, no matter where they are located in Nigeria, get the required and desired healthcare that they need. And how do we do this? By instant delivery of these commodities. It's as simple as that.
Accessing healthcare has been a struggle for a lot of Nigerians in rural areas. And for Malam Muhammad Lowell, this had been the reality for most of his life until recently, when he was down with chronic diarrhea and in need of urgent medical attention.
I started vomiting. I vomited throughout the day till 12 a.m. At this point, nothing else was coming out except the medication I took. By this time, my stomach started hurting. From 2 a.m. till the next morning. I was then taken to the healthcare at Tashan Nabai.
He said he started vomiting since in the evening, and after some time, he started stooling around 4 a.m. His younger brother called me and told me he'll be bringing his brother to the health center. He explained the situation and asked if there will be medication available for him. Knowing my relationship with Zipline, I was assured that if I sent for an emergency delivery, I would get it. Because they had gone to one facility and they were told that there was no medication. But I confidently told them to come, and they brought him in a car. When they brought him, he couldn't walk. They just managed to bring him to the clinic. As soon as I requested for the emergency delivery, it was delivered instantly, and I commenced treatment on him. After giving him the medication, thank God he got better.
Whenever there is such an emergency, if medication is not gotten on time, anything can happen. But we were just given the medication and it was only one phone call away. Of course, this is a progress.
This initiative has become a sure lifeline for Malam Lowell and many others in Kaduna State.
The follow-up call we made after the delivery, Mr. Rabiu said they were able to administer it and the patient was resuscitated. We knew at that point in time that the job we do, it's important. It's saving lives. It's beyond just what we see every day. This is you doing a job that makes a difference in the community.
The state government says this will bring about an overall improvement in the health sector.
It's worthy to note that this project is a significant step towards closing the gap in quality healthcare service delivery within the state. This is because it will significantly reduce the difficulty people experience in accessing essential medicine.
Accessing remote areas in Nigeria has always been a challenge due to the lack of roads, bridges, and other infrastructure. This has left many rural communities without access to healthcare and medical supplies. But now, with the help of these little zips, medical supplies are being delivered to these communities with ease.
What Zipline has done with the very wonderful technology is to cut short, one, the travel time and how long it takes for a life-saving medical product, particular which is the use case for Kaduna for now, right, is to cut short that travel time, right, so that medicines are upon order are instantly delivered to the facilities. And also in terms of access, I have been to communities where there are no roads. I've been to also communities where you are told not to travel until it is the dry season. Basically, what we're doing here is to increase access to life-saving medicines to places or to facilities or people who are basically in hard-to-reach areas.
Since we started in Kaduna, we've been able to impact the supply chain in the state in different areas, not just supplying these medical commodities to the facilities. We've also been able to help the state government in integrating its services to the different facilities. We've delivered over 500,000 vaccines and over 1 million medical commodities. Those are the items we are currently delivering in Pambigua, where we are currently located in Kaduna State. We serve over 300 facilities in Kaduna, and we're still counting.
The zips are also making it easier for medical workers to provide care to those in need. Abdulaziz is in charge of the health facility at Haingada, a community in Pambigua. He says work has never been as exciting as this. On this day, Abdulaziz is in need of medication for one of his patients, and with just a phone call, his order is placed.
Thank you for calling Zipline. My name is Yayuli. Please, how may I help you?
I want to place an order for Ampicillus capsule and Pirozicam.
We'll process it and you'll get an update on your phone as text message telling you when to expect the product.
Five minutes later, his order is delivered.
Before, in this village, we didn't have a chemist. Sometimes when people come to the facility, we have to refer them to Pambegua. If the medications can't be gotten at Pambegua, we just manage with what we have. But with this new innovation, even while examining the patient, we can place an order for medication. Before we are done, it will be delivered. And before, we had to go to PHC Kare to get RI vaccines on Wednesday because we have sessions on Thursday. During the raining season, sometimes when we go, the rain would have flooded the bridge, stopping us from crossing. We would have to wait till the next day. On days like that, we have to forfeit the vaccines. But now we just place an order on Wednesday and then get the vaccine on Thursday by 9 a.m. before the patients arrive at the facility. This has really helped because previously the patients hardly come to the facility. Even those who need vaccines don't come because of the lack of medication. When they come once or twice and they don't get the medicine, they stop coming and go to the general hospital. But for the fact that a drone brings our medication, so many people now visit the health center.
We do normally offering 24 hours services in primary healthcare center Pambegua. So before, we used to buy drugs from the Kashma, that's Kaduna State Health Management Drug Services. So with the effort of the Zipline, actually we reduce at least 65% issues of delay in supplying of drugs, because once you apply or make a requisition, within 5 minutes to 10 minutes, you will get your drugs. It reduces the maternal issues, maternal death, morbidity, and other rates of either morbidity or mortality rates, particularly maternal issues. We do have a lot of clients, unlike before. Before, we used to see 20 to 30 clients. So with the effort of Zipline drugs supply, now we used to see 40 to 50 a day.
With a central pharmacy, medication are properly stored and equally distributed.
Our motto is that every human being on earth has equal access to medication. So we want to have all the facilities on the same level here being that they all get, they all have equal access to medications. So we don't prioritize one facility over the other. Whatever you need at any point in time, we give you. And then we don't give you too much that you won't, you may not be able to consume. So in that way, we cut off, things like expiries or overstocking. We don't send, bulk or medications in bulk to facilities. We are here to just make sure that they don't always run out, and whenever they need, we are there to service them. So that's what we mean by our on-demand delivery service. And that also ensures equitable distribution. Now, classically, what happens in conventional settings is this. You have bigger facilities, holding almost all the products in their in their warehouses in the hospitals, at the detriment of the smaller facilities. Yeah, the small facilities just have a little or none at all, while we have a lot and they are not using. So at a point in time, you find out that those medications have been hoarded, so to say, by the bigger facilities get expired, while other people need them elsewhere. So that's what we try to do as Zipline again, to make sure that there's an equitable distribution. So we give every facility what they need at that moment. Whenever they are out of it, they can always call. A lot of our facilities, due to one thing or the other, may not have the proper equipment for the storage of cold chain medications like the vaccines, right? So what Zipline does is we provide this service for them. We keep their cold chain medications. Whenever they need it, they just give us a call and then we deliver. So they are not burdened about how to store these things again.
Equipped with batteries, these small planes release zero emissions, a step in the right direction to achieving Nigeria's 2060 zero emissions target.
It is fully autonomous, which means nobody controls it like the conventional drone. It flies at 110 kilometers per hour, an average speed of 110 kilometers per hour, and it has a range of 210 kilometers. So we actually have a service radius of about 90 kilometers. And this drone is actually battery powered, a lithium-ion battery. The entire drone has a mass of 20.1 kg with a maximum payload of 1.75 kg. And it can remain in flight for about 3 hours.
With new facilities launched in Bayelsa and Cross River State, Nigeria is gradually working towards achieving universal health coverage.
So we will see a situation where the maternal and child and under 5 mortality in the states will significantly reduce. Apart from that, too, even other illnesses that are not necessarily connected to mother and child health, some of them too, we see situations where people's health condition get worse because they still could not access the medical supplies that they needed. So generally, if this innovation is sustained, what will happen is that the health indicators will improve significantly.
5 years after starting up in Rwanda, research from the University of Pennsylvania found an 88% reduction of in-hospital maternal deaths due to postpartum hemorrhage as a result of Zipline's logistics and delivery system. The launch of Zipline's drone delivery service in Nigeria also has the potential to significantly improve health outcomes in the country, like in Rwanda.